first thing that we have to decide is, will the patient undergo reconstruction or not? So that's the first decision. The patient will definitely undergo the mastectomy. That is needed. But the next thing, which is optional really, is should I or should I not undergo reconstruction? So that is the first question. That is the first decision the patient has to make. The next decision will be, should I do an immediate reconstruction or a delayed reconstruction? Immediate means we coordinate it with the general surgeon. The patient undergoes the mastectomy, and then I'm on standby. When the general surgeon's done with his or her part, we go in and we perform the reconstruction same time. So that's an immediate reconstruction. Delayed refers to when the general surgeon does the mastectomy, lets the wound heal. Patient undergoes all the different treatments necessary and then comes back months or years later for the reconstruction. That is delayed reconstruction. And then we touch on now what are the different types of reconstruction. The three most common would be the expander implant reconstruction, which is what we commonly do here. The second one would be the abdominal flap, also known as a DIEP, D-I-E-P flap, wherein they use the patient's abdomen, the skin, and the fat, and they reconnect it and reconstruct the breast using microsurgical techniques. That's another option. And the third option would be using the patient's back, skin, and muscle, wherein it's moved forward to recreate the breast mound, and sometimes you will use either an expander or an implant with that. So those are the three most common reconstructive options. When you do the expander implant, after the general surgeon is done, to put an expander would be about an hour, hour and a half. When you're looking at using the abdominal flap that requires microsurgical reconstruction, you're looking about 8 to 12, 14 hours. And that requires a couple of days or several days in the hospital. And then using the back, skin, and muscles, about 4 or 5 hours. And that's again an overnight stay. So each option has its own pluses and minuses, and I make it a point to discuss all options with the patient. And if I don't do that particular procedure, I make sure I refer them to the appropriate specialist who does the reconstruction.